Hi, everyone. I have a wonderful pharmacist guest today that has created a supplement that I think you should definitely be selling in your pharmacy because every male, if they get old enough, they're going to probably need this for their prostate issues. So I have Dr. Steve with me today to talk about his Flosom product. Steve, go ahead and introduce yourself and a little bit about how you got to be a pharmacist that created a prostate supplement.
Hi, Lisa. Thank you for the introduction. My name is Steve Nemeroff, and I am a pharmacist of 20 years plus, and I have had a career mostly in retail and hospital pharmacy. Of recent, I've jumped into this development of products and manufacturing and selling side of things. So really excited to introduce Flosom to the community here. And, that's what I'm here to talk about today.
Yeah, we're going to be taking a little bit of a deep dive because it is a great combination of saw palmetto and CBD. And whenever you walked me through this of kind of talking about how it's clinically superior to other options, to me, it was kind of a no-brainer that this is perfect for independent pharmacy. So can you walk everybody through, your little bit of the clinical history, a little bit of the kind of biology, and take us through and tell us why this is so awesome that they should be offering this to their patients?
Only two ingredients in Flosom, and saw palmetto is the first one that I wanted to talk about. It's something that's been around for hundreds of years, dating back to the Native Americans. The thing that really drove my passion for this product was the fact that these plants are grown and harvested 90+% of them in Florida, which is my home state where I was born and raised. And really I've gotten to know the farmers and nurserymen that really know the histology and genealogy of these plants and have been around them their whole lives. So that's what excited me about it and drove my desire to learn more about it. And besides that, it is one of the top 10 herbal supplements in the US and third amongst men's health products. So it's very commonly seen in products, not always dosed appropriately, as I'll show you in the following slides. Also, in the European Union countries, saw palmetto is much more accepted and is actually used more frequently than a lot of the prescription drugs that we see here in the States. So this study in 2019 in the Journal of Urology was the one that really spurred my action to create Flosom. It was a large double-blinded study. It was conducted in China, but it was published here in the Journal of Urology, which is like a gold standard journal for this treatment. All of the endpoints, the primary and secondary endpoints that they looked at, were actually found to be statistically significant. So that right there was pretty amazing. It was over 300 patients. And when you look at the prostate symptom scores, quality of life, sexual function scores, and erectile function scores, we had great improvement. Statistically significant improvement. Also, of course, we know it's well tolerated and safe. One thing to note here is that they noted at the end of the study that product heterogeneity and limited regulatory framework in the States, it excludes the addition of saw palmetto into the current guidelines for treatments for urologists and primary physicians. So when you see your doctor, they're not very likely to use this as one of their first or second line treatments, although it is proven clinically to be effective. And the other ingredient here, I'm sure everyone has heard a lot about. CBD has really grown in popularity over the past years, and it's used for a lot of things. As we know, there's many different compounds within the cannabis plant and the hemp plant. THC and CBD are by far of the most interest and the most studied, and CBD is really what we see in supplements. It's what's legally allowed in the products that we're selling. Of note, for the pharmacists that are listening, it's metabolized through the enzymatic pathway CYP3A4 and 2C9. So if the patients are on other drugs, if your patients are on other drugs that might be metabolized to these pathways, you definitely want to take note of that. They might need to monitor or not take this supplement. So to drill down a little bit more about the hypothesis and why Flosom was created, you have to understand the human endocannabinoid system, which is being taught in medical school and pharmacy school now. So you see that there's CB2 receptors all over the body, but what we want to talk about is that they're found in the smooth muscle of the genitourinary system. And that's what really formulated the hypothesis that this, along with saw palmetto, could be great for the symptoms of BPH and lower urinary tract symptoms. So, knowing that the two most studied indications for CBD are anti-inflammatory and anti-spasmodic, we, hypothesize that these are perfect for what we're looking at, what we want them to do. And they're also commonly used for anxiety and sleep. So, nocturia associated with growing prostate is a huge problem for aging men, and the CBD is an obvious choice for them. This slide here just drills down on the exact area of reference. So you could see that CBD relaxes smooth muscle, reduces inflammation, and promotes a better sleep. The saw palmetto also is known to reduce inflammation. And the one thing I haven't spoke about yet is the breakdown of testosterone. So saw palmetto is used by bodybuilders as well as men that are going through testosterone therapy as a preventative or a protectant for their prostate, because when testosterone breaks down, that metabolite is what's thought to cause the growth of the prostate over your lifetime. Lastly, I just wanted to show a poster project that I made for the American Urology Association conference. It was supposed to be presented in Vegas this year, but unfortunately COVID prevented us from getting out there. The main points here, I just wanted to show that we did conduct a study in a multi-clinic urology practice here in South Florida. We enrolled 13 patients that their average IPSIS score or prostate symptom score was 20.8 when they started. And after 4 and 8 weeks of Flosom, 1 capsule each evening, their improvement was 8.2 points all the way down to 12.6, which is a huge statistically significant difference for those patients taking Flosom. And really, it was a bigger number than what I've seen in any of the saw palmetto studies. So we are planning to do a bigger trial with a double-blinded, more controlled study. But we wanted to get this out there because these were great results for the initial outreach for Flosom. And the other thing I wanted to show, which I think is a really pivotal point for pharmacists, they just don't know the difference between saw palmetto products on their own shelves. So if you go to any big box store, you see that this picture here shows many capsules of dried berry. So that's the saw palmetto berry. That's where the active ingredient is thought to be and where we extract the oil from. But many products just use that dried berry, which you would have to take 18 to 20 capsules of some of these products to equal 1 of our capsules because of the more potent extracted oil that we use. So when you're telling your patients which saw palmetto to get, it's not the most expensive one necessarily or the one that has the prettiest bottle. It actually needs to be the one that has the 320 milligrams of oil extract, which is what Flosom has in it. And that really concludes my presentation. I have here just a pharmacy partner program. So physicians and pharmacists can partner with Flosom and sell the product in their offices or in their stores. We set up wholesale accounts as well as have affiliate programs where you could be rewarded for sending people to the website. If you have any questions about that program or interested in carrying it in your stores, please reach out to me at steve@flosom.com, or you could hit up Lisa and I'm sure she'll send you my way.
Yes, awesome. Thank you, Steve. So I have started to talk to pharmacies about this product. I'm a big fan of just cash-based revenue and adding supplements to that for pharmacies. there's only two ways to grow, and that's either to get more patients or get more from your current patients. And usually pharmacies have so many patients, they don't really know what to do with them. And I think this is one of those very targeted niche products where you can easily identify a subset of your patients that are coming to your pharmacy to recommend this product to. If you just ran a PMS report for men, over the age of 40 in your system, even those that are getting some of the other prescriptive BPH, prostate type of medications, those are going to be kind of your hot list. And even if you just started calling them, texting them, notifying their accounts when the next time they get a prescription filled, that pharmacist is consulting them on, hey, do you have any of these symptoms? Or you're having to wake up at night to go to the bathroom, which I know is you had mentioned when we first talked as one of the most common symptoms that men don't really relate that to, oh, my prostate. They relate it to, oh, I drunk too much fluids too late, or, they make up other excuses, and they don't really realize that that might be the very first early signs of having some prostate issues, but that pharmacists can intervene and recommend this product. And really, just like with any disease, better treatment and better intervention early on is going to be better in the long run for the patient, but it certainly can help patients who are further down that symptomatic path. Those in the, 80s or 90s or 70s, the little more advanced, have often a lot more of those associated advanced symptoms. But I just thought this was a really great product. I love niches. Riches are in the niches. And this certainly can help you, the pharmacy owner, help your patients better, while also helping your bottom line as well. So reach out to Steve at Flosom. That's FLOSOM.com, or feel free to reach out to Diversify RX, myself. I can answer any questions and connect you with Steve, so that you can start selling this product in your pharmacy. So thanks for spending a few minutes with us today, Steve. I really appreciate it. And I can't wait to find out, you've got a whole product of men's stuff, in the pipeline. So I'm excited to learn more about what you're doing for men's health. So thank you for sharing.
Thank you very much.